The development of concept of occlusion can be traced through fiction and hypothesis to fact. The fictional approach was a convenient arrangement of a series of observation and thoughts, more or less logically arranged. The hypothetical approach was based on provisional acceptance of certain logical entities. This was to fill in the gaps in empirical knowledge and thus tentatively complete the picture. Fact is a truth known by actual experience or observation. Both the fictional and hypothetical approach are necessary preludes to the establishment of fact. The development of concept of occlusion thus can be divided into 3 periods. The fictional period, prior to the year 1900, the hypothetical period, from 1900 to 1930, and the factual period, from 1930 to present. The transition from one period to another was gradual, with considerable overlapping. There is another trend in the development of the concept of occlusion, the trend from the static to the dynamic. Coming to the fictional period, pioneers like Fuller, Clark, and Imrie talked of antagonism, meeting or gliding of teeth. The creation of normal standard, a basis on which to compare departures from normal, was lacking. But this served as a working hypothesis, or subsequently became established fact, after definitive research. Eugene Talbot published his book, Irregularities of the Teeth and Their Treatment, in 1903. He attributes facial deformities to maternal impressions and delineates in great detail the adolescent neuroses of nasal and facial bones, developmental neurosis of eye, the maxillary bone, the palate, tooth position, and so forth. The Talbot concept of normal occlusion was that it was a historical event, passed in the decline of the species, and normality was possible only with atavism, or throwback to our primitive ancestors. In the hypothetical period, Edward Angle channelized orthodontic thinking on occlusion, and brought the concept out of realm of fiction. In 1907, Angle summarized his views as, occlusion shall be defined as being the normal relation of the occlusal inclined planes of the teeth when the jaws are closed. Angle cites the example of a skull of Negro male from Brummel, which he names Old Glory. In Old Glory, all the teeth are present and arranged in a graceful curve. He emphasizes that all teeth are necessary for maintaining occlusion. He compares Old Glory with the profile of Apollo Belvedere, a white male. Angle furnished his key to occlusion and emphasizes the first permanent molars, especially the upper first permanent molar, and considers them to be most constant in taking normal position. This formed the basis of Angle's classification of malocclusion, and this has withstood the test of time. From the hypothesis of constancy of first molar and the line of occlusion, Angle developed the concept that all teeth should be present if normal occlusion is to be achieved. Matthew Cryer pointed out that Angle showed the straight profile of Apollo Belvedere and chose a skull of Negro male, Old Glory, to exemplify ideal occlusion. He questioned how one could mix a prognathic denture with an orthodontic profile. Calvin Case took Angle to task for considering bimaxillary protrusion as normal and for not recognizing individual variation. Case accepts Angle's hypothesis of constancy of first molar. He related the facial profile to each type of occlusion. He proposed the concept of apical base and divided dentofacial area into 4 segments, or zones of movement. He was aware of the role of nose and chin button and their influence on profile. Case was the one who proposed the concept of normal and ideal occlusion. Lisher and Paul Simon broadened the concept of occlusion by relating the teeth to the rest of the face and cranium. They related teeth, in occlusal contact, to cranial and facial planes, outside the denture proper. Milo Hellman showed the racial variation in so-called normal occlusion through anthropological studies. Hellman and others studied the prognathism of the human dentition in relation to a cranial base. In 1930, beginning of the factual period, Holly Broadbent, with Hans Planer, introduced an accurate technique of row endogenographic cephalometry. Investigators were able to follow longitudinally the orofacial developmental pattern and the intricacies of tooth formation, eruption and adjustment. They laid emphasis on deficiency of masticating mechanism. They also explained about physiological rest position and vertical dimension, with TMJ as the third element of occlusion.